Hello, my name is Penny Nixon. I'm a pelvic health physio. Claire Brown is my colleague, and today we are delivering a video to help prepare you for your gynaecology surgery. Your consultant will have discussed with you your particular surgery, how this surgery will be performed, and any risks or issues that may be involved, including things like length of stay and the speed of recovery, sort of how many days you might have to stay in hospital. Most patients will be asleep during the procedure, and a few, it will have been discussed with you, will be awake, having been offered a spinal anaesthetic. Some patients have open surgery, which means quite a big insertion in the tummy, whilst others will have a keyhole surgery, which means some tiny little insertions in the tummy, and others will have their surgery via the vagina. If you have any specific concerns about your surgery prior to going to your pre-assessment, then please feel free to contact your specialist nurse to discuss this. We will be advising you today on how to prepare well for surgery and give you an introduction to pelvic floor exercises, bladder training, how to empty your bowels properly, and a few tummy exercises which you can do after your surgery. Recovery on day 1 and 2, any potential issues that you may come across, and some post-op tips and tricks, and there'll be a list of resources at the end. Preparation for surgery. Once your surgery has been agreed with your consultant, then you'll be sent to the ATC for a pre-operative assessment, where they will discuss and make sure that you are fit for your surgery. At this appointment, you'll be told when to stop eating and drinking prior to your surgery, and they'll also have a look at your medications and decide what you can continue to take and what you perhaps shouldn't take. It's really, really important that you're fit and healthy for your surgery, and there are all sorts of things that you can do to prepare yourself. And here are a few ideas. So being as fit as you can be prior to surgery is going to mean that you will recover much quicker. And the recommended guidelines are that you do 30 minutes of moderate exercise every day. Walking counts, but it's walking with a little bit of oomph. Being an optimal weight, which is considered anybody with a BMI under 30, is really what you're aiming for. This makes the surgery itself a lot easier, and again, your recovery time will be quicker. The advice about smoking is that basically you stop, as your healing time will improve. So even if you just stop 2 weeks prior to surgery, it will have a positive impact on your outcome. If you're consuming over the recommended alcohol levels, then again, please reduce, and this will improve your outcome. Bring with you all your usual medication when you come into the hospital, and it's also worth packing some loose-fitting trousers or a floaty dress and some comfy pants, and some slippers with backs so that when you're up and walking about, you'll be very safe, and also a decent dressing gown so that you feel comfortable on the ward. Pelvic floor exercises are really important exercises to do when you're having gynae surgery. They're muscles that link from the pubic symphysis at the front of the pelvis towards the coccyx at the back of the pelvis, and they sit like a little hammock. They have the back passage going through the muscles, the vagina going through the muscles, and the water pipe going through the muscles. So they're supportive muscles. If you can learn to do this muscle work well prior to your surgery, then when you're asked to do it once a catheter is taken out after your surgery, you'll find it much easier to find those muscles and to engage them. So we need to work these muscles in 3 different ways. There's power, endurance, and timing. A power contraction. First of all, sit up nice and tall as if your mum would be proud of you. Then think about tightening around the back passage, then around the vagina, and drawing those muscles up and forward, and then relax. So we'll just talk through that again. So tightening around the back passage, lifting through the vagina, bringing those muscles up and forward, and then relax. When you're doing this muscle work, make sure that you're not gripping with your bottom muscles, no shoulders lifting, eyebrows lifting, toes raising, or any funny faces. So it should be a really private exercise and focus just on the pelvic floor muscles. We really want you to try and do 10 of these 3 times a day. The endurance muscles, this is about postural control, so this is a very gentle lift. So this time, just lift those muscles by a third. Then you're going to hold and breathe for 10 breathing cycles. So engage those muscles just gently by a third. Now hold and breathe, hold and breathe, hold and breathe. Keep them going, keep them going. Keep breathing and holding, breathe and hold, keep them going, keep them going, and relax and let them go. And again with this one, we want you to do 10 of these, holding each one for 10 breathing cycles, 3 times a day. Then the knack, this is about using the muscle at the right time. So when you cough, sneeze, laugh, lift, really do anything that involves effort, we need the pelvic floor muscles to be working first. So it's pelvic floor lift, hold those muscles on, then do a cough, keep those muscles on, and then relax. So you're being very functional about how you use those muscles. We have a lot of information written in the resource list at the end of this presentation. We also have a video on our webpage which goes into pelvic floor muscle exercises in a little bit more detail. And there is a really good NHS endorsed app called Squeezy, which we would really recommend you watching or using, because it reminds you to do the muscle work regularly. Because actually once you got into the swing of doing the muscles, they're not difficult, but certainly remembering to do them regularly can be a bit tricky.
So we're now going to talk about healthy bladder tips. We know that sometimes bladders can give you symptoms such as urgency, where you have to dash to the toilet quickly, and sometimes you may leak on the way. If these symptoms apply to you, then it's a good idea to try and get those symptoms under control. And sometimes you may experience these symptoms after your surgery as well. So these are our best bladder tips that hopefully you can use to help your symptoms now. So first of all, bladders should be able to comfortably hold 300 to 400 mils. It's a storage organ, so your bladder will start to fill up and then it will start to give you sensations that you need to have a wee. Most people wee anywhere between 2 and 3 hours, and these should be good volumes. If you find that these volumes are quite small, make sure that you're drinking enough. So you should be drinking 1.5 to 2 litres every day, and not just other things that might irritate your bladder. So try not to drink just caffeine, alcohol, fizzy drinks or fruit juice. We know that in some patients these can exacerbate and cause urgency symptoms. Make sure that you empty properly as well. So when you're sat on the toilet, give yourself enough time for your bladder to empty fully. Some people find that they may need to start to introduce a little bit of rocking, just to make sure that their bladder can tip and empty everything that's in there as well. We suggest that you, if you feel that you've got these urgency techniques, there are 4 things that I tell my patients that you can do, and again you can start these now. So the first thing, if you get that sudden urge out of the blue that you need to have a wee, try distraction. So think about something else, and think about what you've got to do this afternoon, or have a little walk outside away from your bathroom, walk away from the toilet, and that will help distract you. Most bladders will work on kind of like a contraction, and then the urgency will pass, so that a sudden urge that you're feeling will ease eventually. The next thing you could do are your pelvic floor exercises. So try some short squeezes just to try and override that really strong urgency that you can feel. And if you're stood up, sit down, you may feel this gives you more control. The next thing you can do is apply a little bit of pressure to your perineum, and that's the bit between the vagina and the back passage. We know that applying a bit of pressure to this area can override that really strong urgency feeling you're getting. So you can either do this with your hand, or you can cross your legs really tightly and wait for that strong urgency feeling to go. And the 4th thing you can do, my patients tell me that going up and down on your toes quickly in a sitting position again can help control that really strong urgency feeling.
Emptying your bowels post-surgery in the nether regions can be quite a concern to most people. They're really worrying about how it's going to be. Is it going to be uncomfortable? Are my bowels going to move, having not had anything to eat? So I wanted to give you a little bit of a lesson on how to empty your bowels properly. So normally you wake up in the morning and your colon starts to squeeze. So it's called peristaltic action. We then get up and move around and have a shower, and that really encourages that action to happen, with gravity helping too. We then eat, and the smell of food and the taste of food sets off a reflex which encourages that stool to come away. It is at that point where you really need to go to the toilet. Don't put it off. If you put it off, the stool will be much harder and much more difficult to pass. So go the minute your bowels tell you to go. Us girls were dreadful. We empty the dishwasher, make the packed lunches, and then we might not get that message again until much later on in the day. So first message is the key one. Then it's how to sit on the toilet properly, and generally this is something that men do really well. It's the forward lean sitting position, and it's better if you can put your feet up on some magazines or on a little stool. I've just got a box to demonstrate. So feet up, so you're in a squat position, really on the toilet. Forward lean sitting, relax your tummy and relax your pelvic floor muscles. If things aren't moving quite as you'd like them to, then try saying shh, or try saying idge, and it's idge with a little bit of attitude. Don't do more than 3 idges. If things aren't moving, then just leave the bathroom and come back a little bit later. Okay, sometimes you'll find you'll also need to do a little bit of a rock back and forward to help empty that last little bit of the stool. You will be given laxatives in hospital for about 4 days, I believe. So don't worry about emptying your bowels. These laxatives will help to soften the stool. Make sure you're drinking enough in hospital. It's very warm, and that fluid will help the bowel to get moving as well. We wanted to teach you a little bit about tummy exercises. Abdominal muscles, tummy muscles, work together as part of a team with the pelvic floor muscles, with the diaphragm, and with some little muscles that live between each section of the spine. We know they work together as a team, so by encouraging these muscles to work, you're going to be supporting around your abdomen as well as you can. We would encourage you to do the core stability video that we have put online on the Addenbrooke's website, and if you can get that going pre-operatively, then you'll have much more idea about what you are going to be trying to achieve post-operatively. When you're in hospital, we'll be teaching you just a few basic exercises to get you started. And then a little bit further down the line, you can start to do the core stability video again when you're feeling fit following your surgery. When you feel fit will obviously depend on the type of surgery that you've had. So for some of you, 6 weeks post-operatively, you should be very safe to do the full core stability video that we have put online, as it is a simple exercise video. In time you'll want to progress from that video to make the exercises a little bit harder and incorporate the whole key of using the tummy and the pelvic floor together to support you with your posture and with all sorts of movements that you use in everyday life.
So we're now just going to talk you through day 1 after your surgery and the things that you might expect. So once you've arrived at the ward and you're in bed, you'll probably find that you'll want to get out of bed once your pain is well controlled, and the nurses will help you do that. And we know that early mobilisation can help remove the catheter a bit quicker and help speed up your recovery as well. But there are things that you can do at this stage to help. So we like you to take some nice big deep breaths. You may find that popping your hands at the bottom of your rib cage to help feel your lungs expand can give you some useful feedback. I usually tell my patients to do this 3 times, so 3 lovely, nice big deep breaths and then followed by a cough. And you may think that's the last thing on earth that you should be doing after surgery, but it's really important that you clear any phlegm or mucus in your lungs. We know that having some mucus there can impair or alter the levels of oxygen to your blood. So we need to make sure that we're clearing that so that you stay as well and as healthy as you can. So take your 3 big deep breaths, have a pillow or a towel rolled up, especially if you've had tummy surgery, onto your wound, and then go for it. Nothing is going to happen. Your wound is nice and stable. It will just feel uncomfortable for a very short period of time, but it's very important that you do this. If you're struggling to do this, then do speak to a physiotherapist or nurse on the ward. Do make sure that you're eating and drinking early on. We know again that this will speed up your recovery, so if you feel able to and there's no complications, then do make sure that you're having your 3 meals a day and you're able to take regular sips of water throughout the day as well. We will show you a video a little bit later how to get out of bed comfortably to reduce any discomfort. And at this stage, whilst you're in bed, there are some exercises that you can start to do to help with your tummy muscles recovery. So do have a little look later on in the presentation for this. So that's day 1. And day 2, if you're up and out of bed and you're able to walk quite comfortably back to your ordinary levels, and you're able to have a wee and things are going well, then you will be discharged home. So we're now going to show you the best way to get out of bed. If you have had tummy surgery, then overusing your abdominals can be quite painful. Pain doesn't mean you're doing yourself any damage by any stretch, but this way will hopefully mean that getting out of bed is more comfortable for you. So what Penny's going to do, so Penny's going to bend her knees up first of all. She's going to slightly shuffle her bottom over to one side because we've got a narrow bed, but you might find you need to do this yourself. Then she's going to roll onto one side, and you can pick whichever side you want to roll on, it doesn't matter which side. And then gravity at this stage is your friend. So she's going to wiggle her legs off the end, let them come down to the floor and push up with her upper arms, and then she's up into that sitting position. Give yourself a couple of minutes whilst you're there. Take some deep breaths, roll those shoulders because you've probably been in bed for a little while. And then when you feel ready to, you're going to have a stand up. Now at this point there will be somebody with you at this stage. So if your feet are not on the floor already, you may need to wiggle your bottom forward. And then Penny's going to use her arms to push down through the bed and have a stand up. She's going to need to bring herself forward, so bringing her nose over her knees and then coming up into the standing position. And again, when you're there, just give yourself a couple of minutes, take some deep breaths and try and stand up nice and tall. We know that if you've had tummy surgery, you're going to want to stand over yourself to protect yourself. But it's much better for you to bring your shoulders back and stand nice and tall. Okay. So we're going to show you now how to get into bed. So essentially, it's the reverse process. So you're going to want to step backwards so you can feel the bed on the back of your legs so you know that it's there. Reach back with your hands and guide yourself down. Now you're going to want to think about your position on the bed. You don't want to be too low down in the bed because once you're then lying down, you're going to be miles away from the pillow. So at this stage, you may need to shuffle your bottom a little bit closer to the pillow. Then in this position, Penny's going to lower her upper part of her body down, come down into side, bring the legs up. Lovely. And in this position, you're going to then just have a roll onto your back and make yourself comfortable. Lifting your bottom up when you're moving can be really useful. And again, pain doesn't mean you're doing yourself any damage. Any movement you're going to feel around the area, any discomfort is quite normal, but don't worry. So from this stage, we're now going to show you some tummy exercises that you can start day 1 or day 2 after your surgery, and you'll find these in the resource leaflet at the end of the presentation. Do have a practice of these before you have your operation so that you feel nice and confident that you can do them. Okay, so the first exercise is pulling your tummy in. So Penny's going to rest her hands low down on her tummy, then she's going to pull her tummy muscles in just to feel a nice contraction. Make sure that you're breathing at this stage, and if your catheter is not in place, you can also switch on your pelvic floor muscles. Make sure that you're breathing, taking some nice deep breaths, and if you hold this up to 30 seconds, that will be ideal. Now your second exercise is a pelvic tilt. So again, Penny's going to do the first exercise. She's going to contract the lower part of her tummy muscles, make sure that you're breathing, turn on your pelvic floor muscles, And then she's going to rock her pelvis back so that she's flattening her spine into the mattress. And then she's going to rock it back to your starting position. And you can repeat that again, anything between 5 and 10 times. Again, have a little check, make sure that you're breathing, make sure that your tummy muscles are switched on as well. Now the next exercise are knee rolls. So again, Penny's going to contract the lower part of her tummy, make sure that you're breathing, turn on your pelvic floor if you can, and then with your knees you're going to slowly rock from one side to the other. You don't need your knees down to the mattress, you just need it to be a nice slow and controlled movement. Left and right. And make sure that your hips aren't coming off the bed too much with this one. And again, 5 to 10 repetitions would be ideal. And if you get a chance to do these exercises once or twice a day, that would be great. So once you're comfortable with those first 3 exercises, you can then start to progress and do some more difficult ones. So this exercise is a leg stretch. So with one leg, again, turn your tummy on, do your pelvic floor muscle exercises and make sure that you're breathing when you do this, so you're using all of your core muscles when you're doing these movements. Penny is then going to straighten one leg down into the bed and then bring it back up again. And repeat the other side, and again 5 to 10 times would be ideal. So the idea is it's nice and slow and controlled, it's not a race. Now your next exercise are alternate knee bends. So Penny's going to, again, contract your tummy, pelvic floor, make sure that you're breathing, and then she's going to bring one knee up to her chest, and then back down again. And repeat it the other side. And again, just do that quick self-check. Are you breathing? Are your tummy muscles working? Are your pelvic floor muscles contracting as well? And it's all about using all of your muscles together as a system. Wonderful. Then the next exercise is single knee rolls. So very similar to double knee rolls, but it's just with one leg. So again, contract the lower part of your tummy, pelvic floor, make sure that you're breathing, and then Penny's going to drop one knee down to the side, and then slowly back up again. So it's about 45 degrees out. You don't need your knee down to the floor. And what you're checking for with your hands is that your hips aren't tilting over to one side. They're nice and level, almost like you have a tray of drinks and you're not going to spill them. And again, make sure you're breathing, you shouldn't be holding your breath. And again, 5 to 10 repetitions is ideal. Then your last exercise is bridging. So with this one, again, do your pre-checks. Contract the lower part of your tummy, pelvic floor muscle, breathe. And then I want you to roll your bottom up, so that essentially you're lifting your bottom up. So you can see nicely that Penny was rolling down up through her pelvis, peeling her spine off the mattress, and then she's going to do the reverse. And spine segments touching the mattress, rolling your pelvis down, and back to your starting position. So we'll have that one more time. Lifting your bottom up, peeling up from your spine. Make sure that you're breathing, tummy's working, and then back down again. So we know that after your surgery, there are some very rare potential issues or complications that may arise. So we're not saying that this is going to happen to you, but it's useful to be aware of what can happen. So some patients do suffer with a little bit of wind pain, and this is again quite normal. They fill you up with a lot of air during the surgery anyway, and then after your operation you still have that air inside you. A lot of people will complain of almost kind of like shoulder tip pain. It's referred pain from the wind. Doing some of the exercises that we show you later in the presentation can help that. And the nurses may be able to offer you peppermint tea as well. So if you are struggling with the wind, do let them know. But again, this is another reason why we like you to get you up and walking about early to get rid of that excess wind that you might have. You may experience some pain and swelling around the wound site. So again, if you don't feel that your pain is adequately controlled, then do mention this to your nurse. There may be something else that they can suggest for you. Again, your catheter will be in place. You need to make sure that you're drinking plenty, so make sure that you're flushing through the catheter to avoid complications. You may need to drink a little bit more than you're used to, just to help with this, but as long as the catheter is flowing well and urine is collecting in the bag, that's all good signs. You may also experience a little bit of vaginal bleeding or discharge from the vagina, and potentially some bruising around the wound site as well. So again, this is all quite normal, there's nothing you need to panic about. But if your vaginal bleeding is excessive, you may need to get in contact with your specialist nurse. We do advise with your wound, it's useful to know that it's with glue and not stitches. So keep the area nice and dry and open, let air get to the wound to avoid any complications. You're allowed a shower, but you may not want to get the area too wet, but you're definitely allowed to shower, and just pat dry the area afterwards rather than excessive rubbing. The last thing we like to mention is constipation. So we have already talked about tips to empty your bowels as best you can, but we know that being in bed for long periods of time and having surgery, your bowels can take a little bit of a while to get back to their normal routine. So again, do flag it up with the nurse. If you're worried, they do prescribe you laxatives. But keep an eye on your diet as well. There are things that you can do, as mentioned later on in the video.
Finally, we would like to give you a few post-operative tips and tricks. Return to activity is always a little bit of a concern post-abdominal surgery. So we want to give you a few ideas about what you can do when. What's usually really interesting to think about is healing time. The body takes 3 months to really heal from beginning of the operation to the end point where everything's really knitted together nicely. By the 6-week mark, you really are able to do quite a lot more. So within the first 6 weeks, we really want you to listen to your body and pace activities. We do want you to be moving, we want you to be walking. So start off walking around the house, and as you feel a little bit better, you're going to go a little bit further and a little bit faster with each day. Lifting is always a bit of an issue, and we don't want you to lift anything heavier than a full kettle in that first 6 weeks. So we need you to delegate the hoovering and delegate lifting the shopping, and really look after your body. Think about what you're doing. We want the pelvic floor muscle work that we've taught you and the gentle core stability exercises. Obviously, once that catheter's been removed, we want you to really get going with those. Use the NHS endorsed Squeezy app. It'll remind you to do those exercises 3 times a day. Listen to your body. Your body will tell you whether it's happy or not. So if you are uncomfortable, please take the analgesia. We want you to be moving around and walking. We don't want you to take to your bed. It's really important for recovery that you get up and about and move. Between 6 months and 3 months, you can start to increase the lower impact exercise. So you can start doing speedier walking, you can start cycling if you're comfortable on the perineum, and you could do a gentle exercise class. At the 3 months point, just as long as you've had no hiccups in your recovery, if you've had an infection or a problem with your wounds, then you might want to wait a little bit longer. But you can really get back to your normal exercises, your higher impact exercise, your normal lifting. Driving is always a bit of an issue for patients. When can I go back to driving? There isn't a hard and fast rule. You need to be comfortable wearing a seat belt, you need to be able to look behind you to see whether there's anything coming, and you need to be able to do an emergency stop if a little one runs in front of the car. And we would always advise that you double check with your insurance company just in case you have an accident and you have an issue there, so please contact them. Returning to work is always another question. When can I start again? Well, if you've got a sedentary job, then you should be able to go after that 6 weeks. But if you've got a more manual job with pushing and lifting and heaving, then you really are going to want to have the 3 months off work. So really think about what your job entails, and then you'll get that balance right. Our next slide gives you contact details for the gynaecology nurses, and also how to refer yourself to physiotherapy. So if you're having problems with your tummy or your pelvic floor exercises and you would like to see us at a later date, then you can self-refer yourself via the Adam Brooks website. You'll find a self-referral form on the website, or if you struggle with finding things on the website, you can just pop into physiotherapy and fill out a form behind the reception desk. The final slide gives you a few links to all sorts of resources which you might find helpful or useful, so please use those. And we'd just like to wish you all the best with your surgery and hope that you found this video helpful.